Welcome to r/nursing, where we discover some healthcare professionals should not be healthcare professionals. Nobody who would refuse care to a trans person has any business being in the healthcare as a professional at all. And to me, the very first comment took me by surprise. I've had to remove and ban ignorant and transphobic users in this thread. Don't know what's going on. Maybe there's concerted effort going on. Last month or so, we've seen a huge increase in racist users rearing their ugly heads. And now this week, transphobic users are popping up. Strange times. Please continue to report and challenge these oxygen thieves. I've been a nurse for roughly 7 years, and in that time, I've experienced 2 transgendered individuals in my care. Both times, I've experienced puzzled and or ignorant coworkers whose comments bordered on abusive. We care for the sick, period. That's our job. It isn't our job to judge who is worthy of care. Everyone is entitled to health care in times of sickness. The Snyder marks and persistent misgendering always baffled me as well. That's the reason why gendered people are fearful of seeking medical attention and often have higher rates of illness stemming from discrimination. Transphobia shouldn't be a thing in general, but especially when caring for a sick patient. I'll never forget a young man who came into the hospital one night. His legal name didn't match his gender, but someone had very kindly added a note with his real name. I'll never forget the relief on his face when I called him by it. That was a good nursing touch. Leave a like and comment if you've done something similar. I feel like this should be a standard of practice for everyone, regardless of whatever circumstances are going on. I always ask on admission what the patient prefers to be called. I can't tell you how many times I've gotten a report and the very first sentence is, "This is John Doe, but he goes by whatever name." At my institution, there's a section for preferred pronouns right next to the name in the chart, as well as a spot for an also known as, which is very helpful in these situations. We had nurses intentionally not helping to bed bathe a transgendered female patient. There's no sensitivity, none. I triaged a transgendered female patient for abdominal pain. As part of the protocol, the PA ordered a urinary pregnancy test. A nurse demanded the patient produce a urine for the pregnancy, totally ignorant to the patient's sexual identity and birth gender assignment. It was embarrassing and an error that could have been avoided had the nurse and provider not skipped the sexual identity/gender identity questions in the triage assessment. These errors are contributory factors to why transgender individuals don't seek medical care. You are absolutely spot on. And a follow-up response to the above post. Just so you know, it's transgender without the ED. And here's an interesting follow-up response. If it makes you feel any better, getting asked if we're pregnant is often super affirming. You can find cute posts about trans women being asked for the first time on r/MTF all the time. I had a transgender, male to female, patient who I saw for intake in a plastic surgery clinic for breast surgery. I asked if she had any children and if she breastfed. Usually transitioning patients are triaged a little differently because they have different needs, and if we get them started down the right path so we don't forget any important things we need to do for them. I think if this patient had not said anything then and there, we could have made it all the way through surgery and recovery without realizing she was a trans. Regarding the comment, the Snyder marks and persistent misgendering always baffled me as well. Like, what kind of insecure piece of loser do you have to be to call another human it? Because that person doesn't fit neatly into "there's only boys and girls" idea you have for the world. And someone who identifies as a radish says, big, huge, some might say. Some asshole tried to tell me that being trans is okay, but the medical treatment was a sin. And generally speaking, I know most of our parents generally love us. However, I don't think they understand the breadth of the types of care we deliver to patients. Case in point, this person's mom. My mom. I really don't have anything else to say. She somehow doesn't understand how horrible she is. Yeah, I'm pretty sure my dad would have been a challenge to win over. I got very, very angry at work the other night. because a younger patient, like mid-30s, early 40s, unskilled, walked down the hallway and the supervisor started freaking out and thought someone walked into the facility. The patient's primary nurse didn't even recognize him at first either. Then loudly goes,
"Oh, that's the guy with HIV."
"What the fuck? It's 2020. Know your patients and don't yell their diagnosis in the busy hallway." And then there's this comment to help put your nursing career into perspective. "I saved the life of an enemy prisoner of war who shot me and another member of my squad when I was a medic. If I can take care of someone who tried to kill me, everyone in medicine should be able to take care of a human being who is just seeking medical care, even if you don't understand their sexuality." I've seen the most homophobic, transphobic mentalities primarily among overly religious medical staff, to be honest. Happy to report here that despite working in a rather conservative, semi-rural area, we see a fair amount of trans patients, and despite our political climate, the nurses I work with, at least that I've witnessed, are generally super good and treating patients equally despite their personal beliefs. Like anyone, I have lots of misgivings about my work and work culture at times, but I can honestly say that made me proud. I see a noticeable increase in trans/non-binary patients working in mental health than I did elsewhere, and I myself am trans, but not out at work. Some of my coworkers are ignorant, some are confused, some are downright transphobic. It's really caused me not to feel very comfortable on my unit. I've never had a single transgender patient who was offended by someone saying, "I'm so sorry, I'm not familiar with the transgender community, and it's not a topic covered in depth with us in school. What pronouns do you prefer to use?" I've also never had anyone be offended by honest mistakes that were genuinely apologized for, especially when they can see that someone is doing their best in a situation that they aren't comfortable in. Just talk to your patients. They are just people. They are typically happy to educate others. Then, how about do a little research? Nearly everyone has a computer in their pocket that connects to a vast collective of information. Is it so hard to do a Google search for a basic primer? I don't know what kind of complicated vernacular you think exists, but I think you'll be pleasantly surprised to find you're really going to have to master your patient's name and pronouns. If it's important to talk about the person's original sex, many trans people use assigned or assigned at birth to reference the sex they were, well, assigned. However, you can always just talk to your patient and ask them what they prefer. And I think we can all relate to this next statement, and has a very good follow-up question. We routinely care for the asshole population. How is trans where a nurse draws the line? Right? I don't care about gender, race, sex. If you're nice and respectful, we good. I draw the line at abusive assholes. Oh wait, no. No, I don't. I have to take their shit with a smile on my face. I don't get to draw the line. But if I did, it would be there. Seriously, I take care of dudes who tell me they're going to rape me, of women who shit the bed on purpose because we don't give them Dilaudid for their chronic pain, of patients who spit and kick and bite and punch because they're on drugs, or of mental health problems, or just assholes, or usually some combination of all three. But like people who don't identify with their assigned sex? Nope, that's just a step too far. One of the doctors at my work shames the shit out of unwed pregnant women, but also thinks birth control needs to end. I would not be at all surprised if she was a total dick to trans patients. 99% of the comments I've heard from patients on her is awful. I don't know about you, but I'd hate to have a MD like that. You know what bothers me? I can't speak for other people's nursing school experiences, but we received very little education that was specific to the healthcare needs of the LGBT people. Negative experiences with the healthcare system further marginalize LGBT people and make them less likely to interact with healthcare services in the future. We need to do better by our patients and educate ourselves. I go through enough behind the scenes as a gay male nurse in the South. I can't imagine what it would be like to be trans and try to navigate healthcare before, let alone now, that you can refuse care outright. Maybe it's just my personal and or professional experience, but I've never seen anywhere that can just outright refuse care. Just saying. I've never cared for trans patients. It just hasn't happened yet. But my best friend in nursing is a trans male. He started his transformation after he became a nurse. Not gonna lie, I got salty when the patient started requesting a female nurse for Foley's, pericare, etc. He happily came out and got me when it happened to me with a little smirk on his face. I'm like, damn it, man, why do I have to be one of the only girls on the floor? So, I didn't want to hear some scary shit. My brother's finishing up med school, and several students have expressed discomfort with treating patients that are trans. A lot of them also think they have a place in the hospital now during the pandemic. Their reasoning, you ask? They should be let into COVID-free floors, which by now COVID-free, we know, doesn't mean scary fucking times. He's terrified to practice among these assholes. This next one's a little bit longer, but it makes an interesting point about healthcare systems. This law isn't about allowing individual jerk nurses on your floor to be rude to trans patients and make ignorant comments. Misgendering folks while fucking rude isn't illegal. The ultimate goal of this legislation is to allow conservative or religious medical organizations, such as Catholic-run hospitals, to choose to not provide transgender-focused medical care. Now, when a transgender comes into the hospital for hormone replacement therapy, the hospital doesn't have to continue to provide it while they're inpatient. Patient is considering gender-affirming surgery? Sorry, we don't do that here. And no, we won't make you a referral. This will be awful for a lot of rural, isolated places and underserved communities, where the main or only access to healthcare may be through religious organizations. They want to make hormone replacement therapy, counseling, gender-affirming procedures as difficult to access as possible, just like they did with abortion. I'm a trans person. You have no idea how much it means to see this. Active discrimination in the healthcare sector really damages my community. I once had to go to the emergency room for broken ribs and was made to wait an extra 3 hours for a doctor who was quote unquote comfortable with dealing with me to start his shift. And I'm far from alone from this sort of experience. Getting help for anything, even blood tests or minor things, is really scary for those like me. But every time we do find a nurse or doctor who is accepting, it makes just that little bit easier. Thank you. Thanks for the perspective. Blows my mind that someone with broken ribs waits to be treated because of irrelevant genitalia? Tell me about it. Didn't realize that what my birth certificate said affected the treatment process for rib fractures. Also, kinda unrelated, but if you, or anyone else seeing this, have anything you've wanted to know about trans people / the community, or any question about it, feel free to ask. And someone promptly responded, I have a question about the trans community. Why are you guys so fucking awesome? Has anyone refused a trans person medical care? Everybody knows this. How you feel about a patient or their decisions for their life is irrelevant to caring for them. You care for them. That's the job. I don't care if the person in that bed is a Trump voter, a Biden voter, a communist, a capitalist, a socialist, an anarchist, a Nazi, a D-Day veteran, male, female, young, old, gay, straight, Christian, Muslim, Jewish, atheist, or any other defining characteristic. I'm going to give them the best possible nursing care because that's my job. Sure, I'll call you whatever you want to be called, but the line gets drawn when I have to actually address the real biological / sexual structures your body has to give you the medical care you need. Sorry, things are going to get awkward at some point. I've worked in 3 different emergency rooms at 3 different hospitals in St. Louis. It's happened in every one of them. There were nurses and mid-level providers, and each one who refused to identify trans people by their identified gender instead of their assigned at birth gender. This frequently ends up with the trans person going against medical advice. Management for the first 2 hospitals did not care. My current hospital cares, but not a lot. The one trans woman who is frequent flyer and never goes AMA records her entire visit on her phone every time. Then she posts it to YouTube. Overall, this is a really interesting topic to read, but my biggest takeaway is don't refuse to treat a trans patient just because you don't agree with their lifestyle. And treat trans people with basic decency. Try to get their names and pronouns right. Thanks for watching, and don't forget to like and comment down below for anything that you've experienced that is related to taking care of a trans community. And don't forget to subscribe to listen to more interesting nursing topics.